process. Probably just scrape the bottom of the barrel.
Are y'all ready to get started? Alright, so not a lot of new information from the last time you guys got certified. The only thing that's really new is this video. So hopefully that's new and exciting. We'll watch this and get started.
Heart disease is the #1 cause of death in both men and women globally and claims more lives than all forms of cancer combined. Cardiac arrest may be caused by almost any known heart condition and is often fatal if appropriate steps aren't taken immediately. Cardiac arrest does not discriminate. It can affect all ages, genders, nationalities, and races. This is why early recognition and immediate cardiopulmonary resuscitation, or CPR, are crucial for survival from cardiac arrest. Healthcare providers are the backbone of the systems of care in both the community and medical facilities. Advanced rescue measures cannot be successful on their own without solid basic life support, or BLS. This training will guide you through the key practices of high-quality BLS.
Products are shown for demonstration purposes only. The AHA does not endorse or recommend any specific manufacturer or product. In order to show skills clearly, the healthcare providers in this video do not always use recommended personal protective equipment such as gloves. The AHA's mission of saving lives is a global initiative. The AHA recognizes that heart disease is the #1 killer of both women and men. However, most skills in this video will be demonstrated on male victims to respect global awareness and cultural sensitivity.
What's a woman?
You're saying more men die than women?
It might. I don't know.
Well, it depends on whether they've accepted their birth gender or not.
Alright, so that was the intro. We got probably like a 2-hour class. We'll take a break in like 45 minutes or so. Any questions before we get started?
On any given day and at any time, you could encounter a victim of cardiac arrest because about every 90 seconds, a person dies of sudden cardiac arrest. But with the training you receive today, your actions can give a victim the best chance of survival.
Sudden cardiac arrest occurs without warning or within just a few minutes after symptoms appear. The term heart attack is often mistakenly used to describe cardiac arrest. Although a heart attack may cause cardiac arrest and sudden death, they are different conditions. But it's important to call emergency services for both. There's more information on the differences between heart attack and cardiac arrest in your provider manual.
First, let's talk about the 2 adult chains of survival. One is for out-of-hospital cardiac arrest, and one is for in-hospital cardiac arrest. The 2 chains have 6 links, but the links differ slightly. Both chains include activation of the emergency response system, high-quality CPR, early defibrillation, post-cardiac arrest care, which may be provided in the cath lab or the intensive care unit, and recovery.
For the out-of-hospital chain, the difference is the 4th link, which focuses on advanced resuscitation. In this link, a multi-rescuer team arrives and takes over CPR and may perform additional advanced interventions. For the in-hospital chain, the difference is the 1st link. It focuses on early recognition and prevention of cardiac arrest with patient monitoring and assessment, and, if necessary, rapid response by the medical emergency team when a patient's condition starts to deteriorate.
Now, let's review the links in the out-of-hospital chain of survival as they could happen in a real-life resuscitation event. It's a normal day at the airport. A woman notices that her husband is not looking well. When he collapses, she immediately calls for help, and a security guard rushes over. The guard gets no response and sees no sign of breathing, so he directs a coworker to activate the emergency response system. The out-of-hospital chain of survival begins right here, with the guard's immediate recognition of possible cardiac arrest and activation of the emergency response system. A rescuer must recognize that someone is in cardiac arrest. This person will have signs such as unresponsiveness and lack of normal breathing. After recognition, the rescuer should ensure that the emergency response system has been activated and begin high-quality CPR. Effective bystander CPR provided immediately after cardiac arrest can double or even triple someone's chance of survival. Bystanders who aren't trained in CPR are encouraged to provide compression-only CPR, also called hands-only CPR. When an untrained bystander sees an adult collapse suddenly, there are 2 simple steps to follow. Call 911 and push hard and fast in the center of the chest. Dispatchers or telecommunicators may provide further instructions, including step-by-step coaching on how to perform CPR until trained help arrives.
Some rescuers might find it necessary to provide compression-only CPR until a barrier device is available. The guard begins chest compressions without delay. A second guard returns with an AED. This introduces the next link in the chain of survival. The AED, or Automated External Defibrillator, is a lightweight portable device that can identify an abnormal heart rhythm that needs a shock. The AED can then deliver a shock that can convert a rhythm back to normal.
Most sudden cardiac arrests are triggered by abnormal heart rhythms called arrhythmias. A common and treatable arrhythmia causing cardiac arrest is ventricular fibrillation, or VF. With VF, the heart's electrical impulses suddenly become chaotic and ineffective. Blood flow to the brain and other vital organs stops abruptly, and the person loses consciousness. Death usually follows unless a normal heart rhythm and pulse are restored within minutes. The AED uses voice prompts, lights, and on-screen messages to tell the rescuer the steps to take. AEDs are simple to operate, allowing lay rescuers and healthcare providers to attempt defibrillation safely.
As the emergency medical services, or EMS providers, arrive and take over care, they provide advanced life support, extending the chain to give the person the best chance of survival. Advanced life support can occur in any setting and provides more advanced treatment.
Once the return of spontaneous circulation, or ROSC, is achieved, EMS transports the person for post-cardiac arrest care. Post-cardiac arrest care after ROSC focuses on preventing the return of cardiac arrest and improving long-term survival. Recovery from cardiac arrest continues long after hospital discharge and includes physical, emotional, and family support. These 6 links show the most important actions needed to treat cardiac arrest.
BLS is the foundation for saving lives after a cardiac arrest. In this course, you'll learn the skills of high-quality CPR for people of all ages and practice delivery of these skills, both as a single rescuer and as a member of a multi-rescuer team. Now, let's go back and review a rescue, focusing on the steps of BLS as they happen.
There are several steps of BLS that you'll need to perform when you suspect that a person is in cardiac arrest. First, scan the scene to assess safety. Then, check to see if the person is responsive by tapping and shouting. If they do not respond, activate the emergency response system and get an AED, or send someone to activate the emergency response system. Next, check for breathing by watching the chest to rise and fall.
Abnormal breaths are common in the first minutes of a cardiac arrest. These abnormal breaths are called agonal gasps and should not be confused with normal breathing. Rescuers can sometimes mistake agonal breathing for normal breathing and fail to recognize cardiac arrest and initiate CPR. Seizure-like activity can also sometimes delay the recognition of cardiac arrest.
If the person has no signs of responsiveness, the emergency response system has been activated with an AED on the way, and there are no signs of breathing or a pulse, then immediately begin CPR starting with chest compressions. The delivery of rapid, strong compressions is a priority, but be sure to deliver ventilation as soon as the pocket mask or bag mask device arrives. Once the AED arrives, it is important to use it immediately. We will go over proper AED use later in the course.
You never know what situation you'll face or what resources will be accessible. It's important to have the knowledge and a framework to provide high-quality, life-saving CPR regardless of the conditions and circumstances.
Now we will focus on the individual skills that rescuers perform. It is most effective to perform CPR as a team, but to be an effective team member, you'll need the individual skills of CPR. So we'll start there.
As a healthcare provider, your first step is to assess the surroundings for safety. Then, tap and shout to see if the person responds. If not, you should shout for nearby help or activate the emergency response system in your workplace. Check for breathing by scanning the person's chest, looking for chest rise. Check for a carotid pulse. The technique of feeling for the carotid pulse is usually easier to perform on the side closest to you. Use 2 or 3 fingers to locate the person's trachea, and then slide your fingers into the groove just to one side of the trachea.
You can scan for breathing and check for a pulse simultaneously to minimize time before compressions. The check for breathing and pulse should take at least 5, but no more than 10 seconds. If you observe no breathing, abnormal breathing, or only gasping, and you do not feel a pulse, ensure that help is on the way and start chest compressions immediately.
Before you start chest compressions, make sure the person is lying face up on a firm, flat surface. If you need to remove clothing to expose the person's chest, do it quickly. You need to work with a bare chest because later you'll attach the AED pads to bare skin.
By starting compressions, you are initiating the CAB sequence, or compressions, airway, and breathing sequence. In the first few minutes of a cardiac arrest, there is still oxygen in the bloodstream. Starting CPR with chest compressions can pump that oxygenated blood to the brain and heart. After you give compressions, open the person's airway and deliver breaths. It's important to minimize interruptions in chest compressions to 10 seconds or less. Each time you stop compressions, the blood flow to the heart and brain decreases significantly. When you resume compressions, it takes several compressions to increase blood flow to the heart and brain back to the same levels. So any interruption in chest compressions can result in low blood flow and minimize the chance of ROSC.
To begin, place the heel of one hand on the center of your mannequin's bare chest, over the lower half of the breastbone. Place the heel of your other hand on top of the first. Make sure that your shoulders are directly over your hands with your elbows straight. And when we start, remember to push straight down on the breastbone to get adequate depth. When you push hard and fast. There is some evidence that compressing too deep can increase injuries from CPR. However, a larger problem is that most providers don't compress deep enough. So focus on making sure your compressions are deep enough. Compress at a rate between 100 to 120 per minute while counting out loud, making sure the compressions are at least 2 inches or at least 5 centimeters deep, and allowing the chest to recoil after each compression. We recommend using a feedback device that provides real-time corrective feedback on CPR quality regarding rate, depth, and chest recoil, not just when performing CPR in practice, but also in your workplace. We'll talk more about feedback devices throughout the course, and you will complete some practice and testing with them later.
You can follow along with what's on the screen as you perform compressions yourself. You'll perform 3 sets of 30 compressions after you assess the scene. We'll pause here while everyone gets into position.
4, 0, 1, 0. So what did y'all think of that new video?
It's a lot better than the old one.
It is actually better. There's a lot more info.
Riveting.
Yeah. They have the graph of what happens when you guys stop compressions and how the blood stops flowing to the brain and heart immediately.
Makes sense.
So each of you all have mannequins in front of you. These are brand new mannequins. What are they, like $400 or $500 each?
They're a little under 3.
3? Okay.
You can't place a value price tag on.
They have that device that they're talking about at the end. They actually have a built-in piece. And as you can see, they're all Bluetooth, so we can actually record. And it will tell you each compression that you do good or bad. We have that set up. Is it recording?
One of my on the radio.
So it'll show up for them to see on that little pad, and then I can see it on here.
Okay. So yeah, he's gonna be monitoring your compressions. So this video, just follow along with it. Listen to shoulder.
Okay, let's begin. 3, 2, 1.
Wait,
Are you okay?
Can you check
Are
your
you
Hey, are you
device?
okay?
Pause the video for a second.
Somebody
You
go.
gotta make sure it's working.
Unzip the jacket.
Oh, we don't.
Already
Oh,
in
rip
the
it apart?
No.
Oh.
Bare chest.
Bare chest.
Bare chest.
You're assuming you're walking up to somebody.
If you
and
start
they're-
compressions,
Whoa.
then we'll go. Hello.
Are we all ready? So what are we doing first?
Bare
the
sir.
chest.
Sir.
We're
Checking
checking
to
for
see if they're
circulation,
okay. They
have a
for
pulse.
responsiveness, checking for pulse, checking for breathing,
Initiating 911.
initiate 911.
Quick,
Go get
grab the AED
and come
back
activate
here.
the 911 response system.
Check for breathing.
Alright, here we
So
go.
we're-
Checking for a pulse, and we're following along.
I usually go for
Activate the emergency response and get an AED.
And you still don't have gloves on for this call either? Shock.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 5, 6, 7, 8, 9, 30.
30?
This thing's missing count.
Yeah,
It's
he's
not
2,
counting,
3,
bro.
4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 29, 30.
Yours is fucked up too?
Yeah.
Because you're not doing it good enough.
Oh, we got it.
Does it not count the?
It's not counting.
It's not
counting
counted
some
unless
of
you do it right,
Oh,
bro.
I know why. The threshold.
No reps.
Those first three aren't no good.
They're getting you ready for
I mean, it's
the
working on mine.
challenge.
Is this
supposed to be plugged in?
Yeah.
I got,
Way to go, instructor.
yours wasn't working? Alright, well, my other instructor will assist you in getting that set up.
Wow.
Bro, I got a 98%, bro.
I got a
I'm at
99.
100. I'm at
No, you
99. What does that say right there, Pena? Bro, you're so toxic. Why you call me a liar, dude?
Put your glove on.
Alright, this one, you guys can take a seat for. It's gonna be an instructional video for
So now, first we'll
3
look at the
minutes.
use of pocket masks, and then we'll practice one rescuer skills with compressions and breaths. When you're working, you'll likely have access to a bag mask device. However, because a cardiac arrest can happen anywhere at any time, it's important to be comfortable and effective with a pocket mask. A bag mask device might not be too far away, but when minutes and seconds matter, the time saved by being proficient with a pocket mask is invaluable. We'll use a pocket mask for the one rescuer activity in our training today.
When the guard finishes a cycle of compressions, he quickly places the mask with the one-way valve on the person's face. He delivers 2 breaths and returns to giving compressions immediately to minimize interruptions in chest compressions to less than 10 seconds.
Now let's examine the technique. Place the mask on the person's face, using the bridge of the nose as a guide for correct positioning. Seal the mask against the face by placing the index finger and thumb of your hand that's closest to the top of the person's head along the edge of the mask. Now, place the thumb of your other hand along the lower edge of the mask. Then, place the fingers of that hand under the bony part of the lower jaw near the chin, taking care to avoid the soft tissue under the chin. After that, open the airway by using a head tilt chin lift. By lifting the jaw to bring the chin forward, you'll lift the person's tongue away from the back of the throat, relieving a possible airway obstruction. Press the mask down while lifting the jaw to hold the mask tightly against the face. Give 2 breaths while watching for a slight chest rise. Actually seeing the chest rise with each breath is the best way to ensure that your breaths are effective. Breaths should be delivered over 1 second each, with just enough force to produce visible chest rise. Avoid excessive ventilation and pause about 1 second between each breath.
In this practice session, be sure to hold the mask firmly against the face while lifting the jaw. Also, watch for the chest to rise as you deliver each breath over 1 second. We'll pause here for you to get into position with the mannequins to practice the technique of opening the airway and giving breaths by using your pocket mask with a one-way valve. We'll practice 5 sets of 2 breaths along with the video.
Alright, so we don't have pocket masks. We have BVM. We're always gonna have BVMs. We're not gonna practice this one. But If you were ever out in the field and had a pocket mask, now you know how to use it.
Now let's practice compressions and breaths together by using your pocket mask with a one-way valve. When switching between giving compressions and giving breaths, limit the time between compression cycles and breaths to 10 seconds or less. Make sure the chest rises with each breath, but provide ventilation just to the point of the chest rising. We'll start with assessment and then combine compressions and breaths. We'll be doing 3 sets of 30 compressions with 2 breaths. We'll pause here while you get into position with the mannequins.
Alright, because I'm gonna skip to the BVM instructional and then come back to this practice.
Yeah, when you do the BBM, they'll do CPR and BBM.
Okay.
It's like Catholic Church.
It's like Penny's wedding.
Stand, sit,
Just kidding, it's over, it's not.
stand, sit, kneel.
When participating in a resuscitation event with rescuers from multiple agencies, the real challenge becomes about logistics. In other words, the coordination of rescuers and resources when more people are involved. However, your first few steps are the same.
When you arrive, quickly assess the scene and try to get a response from the victim. If there is no response, call for help or activate the emergency response system. Then take 5, but no more than 10 seconds to check for breathing, looking for signs that the person is not breathing or is only gasping, and at the same time attempt to find the pulse.
Move the victim to a firm, flat surface and begin CPR. One rescuer should start compressions while the second delivers ventilation. After each set of 30 compressions, the ventilator should deliver 2 breaths. A third rescuer should turn on the AED and attach the pads to the victim's bare chest. It's important to know your AED or defibrillator because models can differ. Follow your device's prompts for the next steps.
When the AED signals that it's ready to analyze and that all rescuers must stay clear of the patient, the compressor should switch roles with another rescuer. While the AED is charging, the compressor should take advantage of that time to deliver a few more crucial compressions.
The emergency responder operating the AED is responsible for ensuring that all rescuers are clear from touching the patient to allow for rhythm analysis and before delivering a shock. If a shock is advised, clear everyone and deliver the shock.
As soon as a shock is delivered, rescuers should begin another set of compressions, with a different rescuer delivering compressions, and with a feedback device now in place. Continue these steps until advanced help arrives.
Now let's focus on using an AED. Although AEDs may differ slightly, there are 4 universal steps for operation. To begin, turn on the AED, open the carrying case or the top of the unit and immediately power on the AED. Some devices will power on automatically when you open the lid. After that, attach the pads to the victim's bare chest. Use the diagrams on the pads for correct placement. Some AEDs may have adult and pediatric pads. Be sure to use the adult pads on anyone 8 years of age or older. If you're not sure of the person's age, use the adult pads. On some AEDs, you may need to plug in the pads if they aren't already connected.
After you open the device and power on the unit, follow the prompts and place the adhesive pads on the person's bare chest per the pictures on the pads. Place one pad to the side of the left nipple and the other on the upper right chest, directly below the collarbone. After the AED is turned on, some units will tell you to press a button for the device to analyze the heart rhythm. Others will analyze the rhythm automatically. The AED may take about 5 to 15 seconds to analyze the rhythm.
The AED will deliver an audible prompt when it's ready to analyze the heart's rhythm, followed by a prompt to clear the victim. Strongly repeat the command to clear, checking visually to be sure that all rescuers and bystanders receive the command and follow it. Once the AED completes its analysis, if a shock is advised, it will charge and then prompt again to clear the victim. You'll repeat the command to those nearby. Loudly state something like, "Everybody clear," and visually check to make sure that nobody is touching the victim, not even the person in charge of giving breaths. Then, the shock can be delivered.
Next, press the shock button. The shock may produce a sudden contraction in the victim's muscles. After the AED gives the shock, resume CPR immediately, beginning with chest compressions. Do not remove the AED pads or turn it off. The device will repeat the analyze and shock cycle about every 2 minutes. Follow the AED's voice prompts. If at any time the AED indicates that no shock is advised, immediately start chest compressions.
You'll need to consider a few special situations when using an AED. First, if the person's chest is so hairy that the pads can't adhere to the skin, you may quickly shave the area if a razor is provided. If no razor is provided and you have 2 sets of pads, apply 1 set to the hairy chest. If the chest hair prevents the pads from contacting the skin, the AED should tell you to check the pads. If it does, press them down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then, apply a new set of pads to the bare skin.
Excessive water on the victim's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the victim's heart. If a victim is lying in water, quickly move them to a dry area before using an AED. But if the victim is lying on snow or in a small puddle, you can use the AED. And if the chest is covered with water or sweat, wipe it off before attaching the AED pads, but wipe the chest quickly. It doesn't have to be completely dry.
Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump that's smaller than a deck of cards. If you see this lump, avoid putting a pad directly over it. Also, don't place a pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before applying the pad. If the victim is wearing an undergarment containing metal, be sure to apply the AED pads on bare skin, avoiding contact with the garment.
You should familiarize yourself with the AED model in your workplace. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. AED kits may include additional emergency equipment, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit.
We'll pause here to allow you to get familiar with the AED in your class today. Your instructor will show you all that's included in the kit and demonstrate the correct way to place the pads on a victim.
Alrighty. We're using AED. Alright, so what's our AED?
Life pack
The Life
15.
Pack 15, that's right. What's in there that we may utilize sometimes? They kind of talked about it.
Razors.
Razors, yeah. So everyone should have at least 2 in the little zipper.
AED mode.
Don't use it.
What do we have to do with the chest before we put the pads on? Or what do we have to check for?
Expose the chest.
Expose the chest. And once you expose it, what are some things you could run into?
Water.
Water.
Body
Yeah,
jewelry.
Sweat.
Sweat, yeah. So
Oh, that's a good one, dude.
Yeah.
body jewelry. Dude, my daughter right now, it's like all the time. Has yours started yet?
The drooling?
Yeah, the jewelry's getting out of control right now.
You said jewelry.
Oh, jewelry. I thought you said drooler. See, I'm in dad mode right now.
They took that out of the video.
Because you said water and then you said drool. I thought you said drool.
I was about to say we need to stop recording because we're getting here.
I'm just saying, we had a guy that was a code save and he had body jewelry.
Did you leave him on?
Yeah, I just didn't place it over the body
Man, I
jewelry.
have to take it off.
And he was in water.
Oh,
this
Did you take him out of the water?
We sure did. And we wiped him down.
Alright.
Wow.
And there's one other thing that you may run into. It happens a lot in the nursing homes. The pacemakers.
Patches.
No, the pacemaker.
And the patch.
The patches. Yeah,
Fentanyl
I don't
patches.
really see those very often.
Because they're all over the
Well,
bed.
that's because you had 11.
Yeah.
No, too busy sleeping.
My grandma would fiend for some fentanyl patches.
Providing effective ventilation is critical to successful high-quality CPR, especially in respiratory-related emergencies such as drowning, anaphylaxis, and asthma. Guidelines recommend against excessive ventilation during CPR, and research suggests that some rescuers are less confident and less effective when using a bag mask device on their own without assistance. Because using a bag mask device is such an important skill and is common in the healthcare setting, we'll work on it now. Bag mask devices consist of a ventilation bag and a face mask, and they come in a variety of sizes. You can also use supplemental oxygen with a bag mask device.
To begin, position yourself directly above the person's head. You'll use the EC clamp technique to hold the mask in place. To do this, apply the mask by first placing the cushion at the narrow end of the mask onto the bridge of the person's nose. Then lower the mask fully onto the face, watching for the cushion to bulge as it initially seals against the face. Form a C with the thumb and index finger of one hand and press down on the dome of the mask toward the face to further seal the rim of the mask. The remaining 3 fingers of that same hand should form an E to reach past the edge of the mask along the bony rim of the jaw. To tilt the head back, lift the jaw toward the mask and open the airway.
Make sure you squeeze the mask with your thumb and index finger while lifting the jaw to achieve an airtight seal between the mask and the face. And squeeze the bag with your other hand or push it against your leg or body. If the chest doesn't rise with each breath, you're not providing adequate breaths. If you don't get chest rise, readjust the mask, reposition the head and neck, and try again to ventilate. And then, only if necessary, administer a larger amount of air, just enough to get chest rise.
The critical points of delivering breaths remain the same for the bag mask device as for the pocket mask. 2 breaths are given, with each breath given over 1 second after every set of 30 compressions. Be sure to deliver each breath over 1 second with just enough volume to make the chest rise. Delivering breaths in this way will reduce the chance of gastric inflation, or air going into the person's stomach instead of the lungs. Gastric inflation can cause vomiting and possible aspiration.
If you have multiple rescuers, the most effective way to deliver breaths with a bag mask device is to use the 2-person technique. One rescuer focuses on keeping the airway open and securing the mask, while a second rescuer squeezes the bag to deliver breaths, just enough to cause the chest to rise. The first rescuer will use both hands to seal the mask to the person's face and lift the jaw. The thumbs and index fingers of both hands each form a C to seal the mask against the face, and the 3 remaining fingers of each hand will form an E for lifting both sides of the jaw into the mask. Be careful not to press too hard on the mask, which could push the jaw down and block the airway.
Now it's time to practice the 1 rescuer bag mask technique, so that in a few minutes, we can combine it with compressions to work on a 2 rescuer sequence. We'll pause here to get into position.
Alright, you guys ready? PBMs? These mannequins don't record respirations, dude.
But you will see chest rise and fall.
You don't have a adult one?
She's high.
No, we're doing 1 person right now.
We're short
See
BBMs
it?
there, big guy.
This is my mannequin, bro.
I'm no genius, but
Right, come to the light.
Well, we added a person, so you gotta go right and grab it. Another one.
Sorry, he's not prepared.
all our instructors are
Right,
very
wait.
Super medic, figure it out.
Sir, this is malpractice.
There you go. Alright, y'all ready? If you want to practice real quick.
You're not doing it right.
He's supposed to be arbiter.
Now that we're ready, let's practice using the bag mask device. Follow along with the video. Here we go in 3, 2, 1.
Tilt the head back. You gotta tilt the head backwards.
Give 2 breaths. Watch for
Do you
chest
see my
rise.
chest rise, or am I going blind right now?
Tilt the head back.
C clamp,
Give 2 breaths.
pull back on the
Head
jaw
back.
with the E.
Yeah, that's rising.
Yeah.
I'm not saying it's not rising, you're supposed to tilt
Give
the
2
head back.
If
breaths.
you're getting
See, it's not just
effective
you.
chest rise,
I'm getting gastric distension.
Exactly, that's because your head
Give
is
2
not tilted
breaths.
back.
You got belly gurgling.
Mine?
Okay.
Yeah, mine is
Oh, you
like
got it. Yours is good.
hanging
And
off the
give
side.
2 breaths.
It's a hostile learning environment. Yeah. Let's take constructive criticism, not deconstructive.
Yeah, that is great form right there. I love the CE clamp.
Why, thank you, sir.
That's great
You
chest
know,
rise and fall.
I've been fathering lately.
Well, you just positioned your guy up.
I'll save a life.
Alright, does anyone want to do that again, or you all feel comfortable?
Nah,
with that?
whatever.
Okay.
Super comfortable.
Sure, like plenty of practice later this
Um,
afternoon.
There's 9
We're
lessons,
doing that.
so you guys want to get through lesson 4 and then take a break?
Sure.
Sure.
Engine only.
Sure football.
What happened last shift?
Sometimes treatment
We're going into 2 rescuer now.
either because of barriers to accessing the
Sorry,
victim
Jamie.
or because the arrest was not witnessed. Regardless, CPR is so critical.
The earlier a victim of cardiac arrest receives CPR and shock delivery, the greater the chance of survival and recovery. And early CPR has been shown to double or even triple survival from witnessed sudden cardiac arrest.
For many healthcare providers and other rescuers, the 2-person or team rescue is a more common occurrence. So let's first look at the roles for 2-person rescues.
The first rescuer should begin CPR with chest compressions while counting out loud and delivering breaths. Basically, they're handling the situation at first as a 1 rescuer scenario. The second rescuer is responsible for powering up the AED and attaching the pads, as well as providing ventilation when a device becomes available. It's important to remember that the rescuer performing compressions should switch roles about every 2 minutes to avoid fatigue and ensure that compressions remain effective. The compressor should pause when ventilations are being given until an advanced airway is secured. The compressor may also need to briefly pause when the advanced airway is inserted. And if you're performing CPR without an AED, you should switch roles when fatigued or after every 5 cycles. That's about every 2 minutes. When an AED is present, switch roles every time the AED tells you to reanalyze, or sooner if the compressor is fatigued. This switch should take less than 5 seconds to minimize interruptions in chest compressions. We'll learn more about how to effectively switch roles in the team dynamics section.
In 2 rescuer CPR, each rescuer has a specific role. Let's review these roles while watching them play out. Rescuer number 1 should be positioned at the person's side, ready to perform chest compressions and count them out loud. And rescuer number 2 should be positioned at the person's head. It's rescuer 2's role to maintain an open airway and give breaths with a bag mask device while watching for the chest to rise and avoiding excessive ventilation. Rescuer 2 should also encourage rescuer 1 to perform chest compressions that are fast and deep enough and allow complete chest recoil between compressions.
Vehicle fire close to the building.
Now let's practice 2 rescuer BLS. Follow the video as you practice. We'll work on the full sequence, from the point of finding the victim until advanced medical help arrives.
We go.
We'll pause here for you to get into position for the 2 rescuer practice.
Alright, just a quick review. 2-person CPR, what's the rate?
30 to 2.
30 to 2.
Until you obtain an advance.
Ooh, that's correct. Or you get.
How often should you switch?
Every 2 minutes.
Unless
Five
you
How long?
succeed.
How long should that take?
5 cycles.
What? 5 seconds.
5 cycles or
You're answering the wrong question. I didn't go that route.
I'm sorry, sir.
Yeah, we should do. Alright, go ahead and pair up and we'll practice.
It's gonna be
You want to be the compressor, bro?
sorry, but your fire is so far.
bro.
Okay, let's begin. In 3,
You okay?
2, 1.
Hey.
Hey,
Hey.
I don't feel call 911. Get an AED.
Are you
Got it.
ready?
911.
Activate the emergency response.
Get the
And
AED.
get the AED.
No pulse. Oh, who's dying?
I need whoever's in charge of the
There's no
station.
breathing.
Oh, that
no
would be
pulse.
me.
Oh, Pena.
I'm gonna help you out. What's up?
4, 5, 6,
There's a fire exit, gotta go.
9, 10, 11, 12,
Very good rate. Very good death.
16, 17, 18, 19, 20.
Remember, compress at a rate of 30. At least 2 inches, allowing full recoil.
Get breaths.
9, 30. 1 breath,
1,
2 breaths.
4, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Good
recoil there.
Thank you.
Very good. Scobie, I think you can go a little bit deeper, but keep up the good work.
We have green.
Deeper.
Oh, yeah.
You were all in green. Good job. This one actually be helpful.
That was helpful to load this.
I'm surprised you guys haven't mentioned it yet.
I'm not gonna stop. I'm trying to catch up on my numbers.
Alright, good job, guys. We'll take like 5 or 10 minutes.
Okay.
Alright,
Shall we
listen
pause
to
and
the
leave it
on-scene
running?
report.
Yeah. One of your breaths.
Oh, breakdown? Good. Pena. You wanna know what your